One of the most common questions people ask online is about size, how to increase length, improve thickness, or simply feel more confident about their body. This topic comes up repeatedly, which shows just how widespread the concern is. Today, let's break it down using facts, medical insight, and realistic expectations. First, it's important to understand what a urologist does. A urologist is a medical specialist who focuses on the urinary system and male reproductive organs, handling both medical conditions and surgical treatments. With that perspective, we can approach this topic with evidence rather than myths. Interestingly, large-scale surveys involving tens of thousands of men have shown that more than half feel dissatisfied with their size. However, when their partners were asked, a significant majority reported being satisfied. This contrast highlights a key issue. Perception often doesn't match reality. So, what is considered average? Research across multiple studies shows that the typical erect length is around 5 to 5.5 inches, approximately 13 to 14 centimeters. Variations above or below this range are still considered normal. Only in rare cases, less than 1% of the population, does a condition known as micropenis occur, where the size is significantly below the standard range due to medical or developmental reasons. Despite this, many individuals who fall within the normal range still feel inadequate. A big reason for this is unrealistic comparisons. Media and adult content often present exaggerated standards, making it difficult to understand what's truly typical. Over time, this can distort self-image and create unnecessary anxiety. Even when measurements fall within the normal range, many individuals still experience deep chinta, anxiety about their size. This condition is often referred to as small penis anxiety, and it's more about perception than actual physical reality. This type of anxiety can become intense. Some individuals spend hours each day thinking about their size, constantly comparing themselves to unrealistic standards. In more serious cases, it can interfere with daily life, relationships, and mental health. For a small number of people, it can even lead to depression or extreme distress. This issue is closely related to body dysmorphic disorder, where a person becomes overly focused on a perceived flaw. The important thing to understand is that the distress is real, even if the physical concern is not medically significant. That's why addressing the mental aspect is just as important, if not more important, than focusing on physical changes. Another major problem is the overwhelming amount of misleading information available online. A simple search can lead to countless products, procedures, and promises that claim quick and dramatic results. Unfortunately, many of these are not backed by science and can even be dangerous. Some individuals go as far as seeking treatments from unqualified providers or traveling abroad for risky procedures. This can lead to severe complications, including permanent damage. That's why it's strongly recommended to consult qualified professionals, such as licensed urologists or mental health experts, before considering any intervention. Medical organizations have also emphasized caution. Many enhancement procedures are still considered experimental and are not recommended for routine use, especially for individuals with normal anatomy. The risks often outweigh the potential benefits. The key takeaway here is that mental well-being should come first. Addressing anxiety and building a realistic understanding of one's body can often eliminate the desire for unnecessary treatments altogether. When it comes to non-surgical methods, there are a few options that are commonly discussed. However, not all of them are effective, and some can even be harmful. The first and most important approach is psychological counseling. Studies have shown that when individuals receive proper guidance and education about normal size and body image, many of them no longer feel the need to pursue physical changes. This makes counseling one of the most effective and safest options available. Beyond that, there are 3 commonly mentioned non-surgical methods: traction devices, vacuum devices, and injections. Traction devices, also known as extenders, are designed to apply gentle, consistent stretching over time. These devices are worn for several hours a day over many months. Research shows that with consistent use, they may result in a small increase in length, usually around 1 to 2 centimeters. While this is measurable, it requires significant dedication and patience. Vacuum devices, on the other hand, are often used for improving blood flow and erectile function, not for increasing permanent length. Studies indicate that they do not lead to lasting size changes. Then there are injectable treatments, which are highly controversial. Various substances have been used in attempts to increase girth, but many cases have resulted in serious complications. These can include infections, deformities, and long-term damage that may appear years later. Because of these risks, medical professionals strongly advise against injections for enhancement purposes. The lack of consistent, safe results makes them an unreliable and dangerous option. Overall, among non-surgical methods, traction therapy has the most evidence, but even then, the results are modest. Counseling remains the safest and often most effective solution for those dealing with dissatisfaction. Surgical procedures for increasing size are often seen as a quick solution, but the reality is far more complex. While several techniques exist, most come with significant risks and uncertain outcomes. One commonly discussed procedure involves cutting the suspensory ligament, which attaches the penis to the pelvic bone. By releasing this ligament, more of the internal portion becomes visible externally, giving the appearance of increased length. However, this does not actually increase functional length and can lead to complications such as instability or changes in erection angle. Other surgical methods include tissue grafting, fat transfer, and even the use of cartilage. While these techniques aim to enhance length or girth, the results are inconsistent. Many patients report dissatisfaction, and complications such as scarring, infection, or deformity are not uncommon. Another issue is the lack of high-quality research. Many studies on these procedures are not well controlled, making it difficult to determine their true effectiveness and safety. Because of these concerns, most experts do not recommend surgery for individuals with normal anatomy. The only situation where it may be considered is within a controlled clinical trial. These trials are conducted under strict supervision, with ethical guidelines and safety monitoring in place. Clinical trials involve oversight by review boards that ensure patient safety and accurate reporting of results. This allows researchers to evaluate whether a procedure is truly beneficial or too risky for general use. Without this level of oversight, undergoing surgery can be a gamble with serious consequences. That's why caution is strongly advised when considering any surgical intervention. When everything is considered, the options for safely increasing size are quite limited. While some methods may offer small improvements, none provide dramatic or guaranteed results without risks. Traction devices may offer minor gains with consistent effort, but they require long-term commitment. Surgical procedures carry significant risks and are not recommended for most individuals. Other methods, such as injections, can lead to severe complications and should be avoided. Given these realities, the most important step is addressing the psychological aspect. Building confidence, understanding normal anatomy, and reducing anxiety can have a far greater impact on overall satisfaction than any physical change. It's also important to avoid making decisions based on unrealistic expectations or external pressure. Many concerns stem from comparisons that are not grounded in reality. By focusing on accurate information and professional guidance, individuals can make safer and more informed choices. If concerns persist, consulting a qualified healthcare provider is always the best course of action. They can provide personalized advice and help determine whether any treatment is appropriate. Ultimately, health and well-being should always come first. Making informed decisions and avoiding unnecessary risks can prevent long-term complications and lead to better outcomes overall. Take care of yourself, stay informed, and remember that confidence and well-being go far beyond physical measurements.